Good afternoon, everybody. I am Leona Gilbert, CEO of Tezted, and I'm on a mission to get the patients tested appropriately so that they can be treated. I would like for you to imagine that you're walking in the forest right now, but you just discovered that you have been bitten by a tick. 50% of us bitten by a tick, will not get a proper test. Therefore, we will not get a proper diagnosis using the existing technologies. Basically, we need to have better diagnostics. Lyme disease, which is caused by Borrelia, is one of the most common tick-borne diseases in North America and Europe. And it's triggered by one of the many pathogens transmitted by that tick bite. Lyme disease is an acute disease, but it also is a chronic disease. And some of the symptoms do include fatigue, joint pain, depression, and cognitive impairment. But just recently, CDC in the States has recognized the existence of chronic symptoms attributed to a Borrelia infection, that bacteria coming from a tick bite. The problem with testing for tick-borne diseases is that the standard of care involves testing one microbe at a time and one disease stage at a time. Already, we have 1.2 billion people infected with Borrelia, and out of these treated individuals, we have 20 million chronic Lyme disease patients, as attested by these celebrities. So everyone knows somebody that is suffering from chronic Lyme disease, and we need to change this outlook. So our solution is this, TickPlex. We are testing 15 microbes, not one, and we're testing for 3 different disease stages, not one. So we're testing for acute, dissemination, and late stage. TickPlex is clinically and analytically validated in 1,500 patients that were tested against 20 microbes coming from that one tick bite. It is CE and IVD marked, so it fulfills all the regulatory requirements. We have 12 granted patents. So let's look at this patient's journey here. Jonas Berghall from Finland, a film producer, writer, and director. He spent 12 years, visited 82 doctors, and spent 60,000 euros of out-of-pocket expenses to get tested appropriately so that he can get a personalized treatment and recover. So with TickPlex, his clinician developed this treatment protocol, and he's 95% recovered. Simply put, Jonas states TickPlex saved his life. TickPlex is unique because we are testing multiple microbes, not one, multiple disease stages, not one. And the true advantage of using TickPlex is that we will minimize the steps needed for treatment protocols. We will also prevent chronic Lyme disease and chronic tick-borne diseases, and we can speed up recovery for the patients so that they can return to the quality of life. Our commercial validation through our global early adopters utilized a B2B business model where we directed people, patients, and clinicians to these clinical laboratories because they know how to test for tick-borne diseases and they know how to treat. Now these laboratories are being recognized in their own countries as leading experts for testing for tick-borne diseases. TickPlex market dynamics looks like this. So if we concentrate on Germany, it's 6 million euros. But if we expand it to North America and Europe, it's 1.5 billion euros. And even further expansion into Russia and Japan, we're at 11 billion euros market. So now we're focusing on initially expansion in Germany. So we're going to recruit sales and marketing partners to build awareness, recruit commercial partners for testing, and key opinion leaders. Our immediate capital requirements is 1.2 million euros for expansion in Germany to focus on sales and marketing. But subsequently, we are requesting 5 million euros each for rollout in other territories like Mexico, US, and Canada. And our projections are ambitious. For 1.2 million euros, we'll reach 66 million euros in revenues in 2029. But for other rollouts and those investments, will reach 800 million euros. The team behind this, co-founder Kunal and I, and 5 advisory board members and 2 scientific committee members that are committed to do this rollout and get the patients tested. So why invest in us? Because we're clinically validated, we're generating revenue, likely to become the standard, industry standard by 2029, and we have multiple opportunity exits for our investors with at least 10x return. We're a highly de-risked opportunity investment, and I would like to ask you, if you want to get the patients tested appropriately, come talk to us. Thank you.
I'll go first. So thank you for the presentation. And would you mind, I'm not an expert in the field, would you mind to just give us some more information about the reasons why a better diagnostics is needed in order to improve clinical outcomes, which is reasonable, but in this specific context, I don't really know.
Yeah, so the sensitivity of the existing test kits are only 50%. That means it's tossing a coin to get a proper diagnosis. And that's why in the United States, there's this two-tier system. So you really need about 4 different tests to get a proper diagnosis. And because of that lack of sensitivity, I mean, these tests were developed in 1980, early 1990s, okay, and hasn't changed much since. And the other problem is that I hope that came across in my presentation is they're really testing one pathogen at a time and one antibody type at a time, so one disease stage at a time. And that can lead to chronic conditions because tick pass multiple microbes to the person. It's not just Borrelia, the most prominent one. It's Babesia, it's Ehrlichia, it's Rickettsia, it's Powelson virus, it's other flaviviruses. So we need to be aware that we have to have kind of like a holistic approach, especially if somebody's been bitten by a tick, and test for multiple microbes.
Thank you. And just a very quick question again. And so you're already generating revenue, so congratulations.
Thank you.
So now, what's the biggest challenge to scale this up?
Yeah, so the biggest challenge is actually moving to environments like United States, because that's where the highest prevalence is. And that challenge there is because they're moving into a kind of gray area in regards to their laboratory developed tests. So the challenge would be is how FDA handles laboratory developed tests, and ours would be that test until we get history on American samples and so forth. But we have a plan B to overcome this challenge, and we've submitted paperwork for regulatory approval in Mexico. So if we get that approval soon, hopefully, then our test kit will be fast-tracked for FDA approval because of the North American free trade agreements that they have. Thank you. Yes, Antonio.
Very good question. When you look at the patient journey, is the misdiagnosis the real met need, or it's the fact that healthcare providers are not able to recognize that these people should be tested for Lyme disease, kind of?
Yeah, I think it's a combination of both for this reason. The guidelines still dictate, focusing on Borrelia bacteria and focusing on, testing for Borrelia and one antibody, like IgM first or IgG first. And that's it. That's the guidelines. So GPs or, normal clinicians in private practices, they follow the guidelines, and the guidelines need to change. And we are working on that with our colleagues, and the guidelines need to encompass that there's other microbes coming from that tick bite. And hopefully clinicians, can read the guidelines, get attuned to the guidelines, and learn that they need to start thinking about multiple microbial infections from a tick bite and not just, that Borrelia infection.
Thank you.
No, thank you. Yes.
Well, thank you very much for the kind presentation. It was very nice and clear for me, at least. So regardless of the subtypes, as far as I understand, the standard of care doesn't differ much, right? And it requires quite a bit of a clinician training down the line. So I was just wondering if you can comment on that.
Yeah, so it's interesting about the subtypes because there is this kind of misunderstanding that there's American or North American, species of Borrelia, and then there's European. But actually, They're seen in both continents, all the three major ones. So I think the point is that by default, if we have the three most prominent species of Borrelia, okay, in those test kits, then there's not a need for a lot of training for this. But what is needed in the medical textbooks, I believe, is we need to get rid of the germ theory, which actually enforces this one microbe testing, one disease test, and actually entertain and encompass, and embrace that multiple microbes can contribute to the infectious disease state of an individual.